I'm about to challenge something that many of us were taught in veterinary school. Should wet to dry bandages just disappear from veterinary medicine? Some surgeons say yes, and others still say they have a place. So, what does the evidence actually say? A wet to dry bandage is exactly what it sounds like. You place saline soaked gauze directly on a wound. As it dries, it sticks to the tissue, and when you remove it, it pulls away debris. But it also pulls away tissue. So, for decades, this was one of the primary ways to debride a contaminated wound. It was inexpensive, it was simple, it was readily available, and before today's advanced wound dressings, it often worked. But here's the problem: we now understand that wet to dry bandages are what we would call non selective. They don't just remove dead tissue, they also remove healthy granulation tissue and newly formed blood vessels and fibroblasts and epithelial cells that are trying to close the wound. So, in other words, they can restart the healing process every time you change the bandage. They're also painful. Anyone who's removed a dried gauze bandage knows it hurts. Both human and veterinary wound care literature recognize wet to dry dressing changes as a painful experience and traumatic. So, today, one of our goals is to reduce wound pain whenever possible. So, what changed? Well, modern wound care shifted towards something known as moist wound healing. Instead of drying wounds out, we keep them in an environment that supports cell migration and growth factors and new blood vessel formation. Plenty of research has shown that appropriately moist wounds generally heal faster with less pain and better tissue preservation than wounds that are repeatedly subjected to non selective mechanical debridement. So, are wet to dry bandages dead? Well, not necessarily. Some clinicians still use them, especially in the first 24 to 48 hours of a heavily contaminated wound, or when surgical debridement isn't an immediate possibility, in a resource limited setting, or as a temporary dressing before referral. But even then, many wound specialists now prefer other methods. So, what are the alternatives? Well, hydrogels for dry wounds, calcium alginate for heavily exudative wounds, foam dressings, hydrofiber dressings, medical grade honey, negative pressure wound therapy, surgical or sharp debridement when appropriate. These options are often much more selective and less disruptive to healthy tissue. So, what does the evidence say? The trend in both human and veterinary wound care is very clear. Use wet to dry dressing sparingly, if at all. And most modern wound care guidelines emphasize moist wound healing, preservation of viable tissue, and selective debridement rather than repeated mechanical trauma. Now, that doesn't mean wet to dry bandages are never appropriate, but they are really no longer considered the default approach, and they shouldn't be. I mean, when I trained, wet to dry bandages were part of routine wound care, and today my approach is completely different. Our understanding of wound biology has changed dramatically, and our dressings have improved greatly. So the goal isn't just clean a wound, it's to create the best environment for healing. So here's the controversy: should wet to dry bandages become a historical technique, or do they still deserve a place in the modern wound care toolbox? Let me know what you think. Follow me for more evidence based veterinary medicine.